little bit more time, but we can start with some introductions. I'm Emily Andersen. I'm with the Gazette. I'm running the Human and Social Services track for this in-depth week and for Iowa Ideas later this year. And then we've got here with us as well, Brian Bush. He's also with the Gazette. He's going to stay quiet. He's running the tech things, so you'll see his face there, but he'll be sending me questions and anything from the audience. Just so audience members, feel free to send in questions. And then, yeah, welcome. This is the Iowa Ideas Thursday session. We're looking at law enforcement. All right, children's mental health in law enforcement. And so here with us to talk about that, we have Drew Martel with Foundation 2. And then we also have Chief Tupper from the Marshalltown Police Department. And they're going to talk a little bit. Both of you are involved in some programs that are connecting law enforcement with mental health services. So to start off, if you both just want to introduce yourselves and then tell us a little bit about your background, your connection to law enforcement or mental health services, and how you're connected to the topic today.
Go ahead, Drew.
All right. Thanks, Mike. So I'm Drew Martel. I'm the Director of Crisis Services at Foundation 2 out of Cedar Rapids, Iowa. I'm also a mental health professional in Iowa, work in private practice, and then I'm also a site surveyor for the American Association on Suicide. In addition to that, I was, for the law enforcement piece, part of the original group with CRPD that wrote the grant to build out our co-responder program back in 2016, which now we've expanded to 9 different law enforcement departments in Eastern Iowa.
Okay. I'm Mike Tupper. I'm the police chief in Marshalltown, Iowa. I've been a law enforcement officer in Iowa for just about 30 years. I've been a police chief in Iowa for the last 18 years, and the last 11 of those years have been in Marshalltown. We started a program actually we obtained funding for the program late 2020, but we kicked off the program in early 2021. We started a co-responder program here in Marshalltown, partnering with YSS of Marshall County, and we currently have social workers embedded in the police department and going out to calls for service with our law enforcement officers for the last 18 months now.
Awesome. So just a reminder to the audience, you can send in questions through the Q&A feature, and hopefully we can get some of those answered if you have questions for Mike or for Drew. And then, yeah, so to get started, you both kind of mentioned this in your introductions, that your different programs that you're working with that are connecting law enforcement and mental health services. Can you both kind of walk us through, you're kind of on different sides of that, that coin, where Mike, you're working with law enforcement, and Drew, you're on the other end where you're working with the mental health professionals. But can you kind of walk us through, in both of your cases, how these programs that you're working with got started, and kind of where the idea came from, why you decided it was a necessary thing that for your community to look into?
Okay.
And Mike.
Okay. So a little bit about my background. I went to college actually and majored in sociology, and I thought I was going to be a social worker, and that kind of changed along the way, and I became a police officer. But I learned very early on in my law enforcement career that a lot of what we do every day is social work. It's crisis response work. We answer about 850 calls for service a week here in Marshalltown, and over 50% of those calls really have nothing to do with law enforcement. And we find ourselves in the middle of a lot of social service issues frequently. So in 2020, there was a lot of discussion across this country about policing and about policing reform and how we can do a better job of serving our communities. And we had some good discussions here in our own community about how we might be able to reform some of the things that we're doing so that we can meet the needs of our community. And as a police chief for the last 18 years, I've had the good fortune of having a partnership with YSS, which is headquartered in Ames. And so they're providing crisis services and social services in our community every day. And I reached out to my friends at YSS and started having a discussion with them in 2020 about what it might take for me to hire a social worker to work within the police department. And those discussions kind of grew from there to the point of, I realized that I would get better bang for my buck if I contracted with an outside entity that could provide a wide range of services, as opposed to me trying to hire one employee that we may not be able to stretch those resources as far as we need to. So we ended up going to our city council in September of 2020 with an idea about a co-responder program where the police department would work with YSS of Marshall County, and we would embed social workers within the police department, and they would go out and help our police officers deal with social service calls and crisis service calls. And we knew it was going to cost $150,000 to do a 12-month pilot project. We knew that. And we were only asking the city council for $25,000 because we're a poor community. I didn't think we'd get $150,000. And we were going to try to secure the first 25, and then we were going to write some grants and do some more fundraising. After about a 40 minute discussion with city council, they gave us $150,000 because they knew how important this project was, and they understood the potential of this project, and they knew it would transform the services that we're providing, but also it was going to be a game changer in terms of helping the community deal with some very complex issues. So they gave us $150,000 in September of 2020. We kicked off our 12-month pilot project in January of 2021. We had 2 social workers hired by February 1st, and we've been in business ever since. So I, having worked in law enforcement for a long time, know a couple things about cops. Cops don't like change, and they don't like things the way they are. And so I wasn't sure how the police officers would receive this new program because we've never done anything even remotely close to this before. Our police officers are 100% on board. They love it. It's been a great transition, quite frankly. The only complaint I received from police officers about the program is, "Hey, Chief, they went home at midnight. We needed somebody at 2:00. This is a service that we really need 24/7, and we're not quite there yet. But it's been a great adventure so far for us.
Yeah, definitely. Drew?
So a similar road. We've had a mobile crisis team since about 2001 here in Eastern Iowa. Worked with law enforcement. In 2016, we were looking at some innovative programming nationally and became interested in a co-response-like model. We ended up going through partnering with the Cedar Rapids Police Department and co-writing a grant through the Bureau of Justice Administration to test pilot our program, which we received. We then, after a year of testing it out, we went ahead and expanded that, wrote another grant through the Bureau of Justice Administration for about $250,000. And since then, we've had several departments approach us about our co-response-like program. And so now we have kind of a mixture of sheriff's departments and police departments, rural and urban. And we are actually piloting 2 different models of co-response, one in which you have a crisis counselor partnered with a dedicated police officer, a dedicated co-responder, and one that we are calling the Mercenary Model, where we just give a co-responder to a department and let them use the individual however they want. Both models are successful in their own way, but this was really an attempt, as a society, we've done a great job advertising 911, and it's utilized as such. Haven't done such a great job with crisis services, crisis response services nationally. That hopefully this summer, with the transition to 988, the 3-digit National Suicide Prevention Lifeline, that will improve access for individuals to crisis lines. But as it stands, law enforcement is on the front response of mental health crises in the United States, and that's no different in Iowa than anywhere else. And so this type of programming was really appealing to us in terms of getting a crisis counselor out there with law enforcement and hopefully to provide a bridge into the mental health system for individuals interacting with law enforcement.
Yeah, thank you. So with this week's theme, we are specifically focusing on children's mental health. And I know both of your programs is very broad as far as, you know, who you cover, but have you seen specifically that this has affected children and families in any particular way that kind of stands out to you that you've seen so far with the work you've done?
Yeah, in Marshalltown, we have. I mean, a lot of the calls that we respond to deal with, well, the vast majority deal with mental health, but family conflict is a big part of some of the calls that we respond to that really aren't law enforcement issues yet because nobody's committed any crimes, but it's families or parents struggling, trying to take care of kids or deal with kids that are dealing with their own set of problems. And so we have found that when we respond to a call, sometimes we think we're just going out to deal with an adult who's having an individual crisis. But when you start peeling back the onion, you realize that there are some family dynamic issues that are at play here. And there's always children involved at some level. And our resources are being utilized to help kids keep them out of the criminal justice system. First of all, that's our number one goal for this program, is to divert adults and kids from the criminal justice system. But we've been able to provide families with a lot of mental health resources so they can deal with some very challenging family dynamics.
Yeah, definitely. Have you seen that as well, Drew?
Yeah, I mean, I think we can all agree that many of the calls involving families to law enforcement are probably not necessary of law enforcement response for a variety of reasons. You know, that there are still several challenges we face, which is diversionary options for youth and families. You know, so this is a piece of that puzzle, but this is not the whole puzzle, and there are still significant gaps in our system around serving youth and families and options of where they can go when in crisis. But I think this is a really good first step. You know, I'm going to guess that in the next 10 to 20 years, you're going to, across the United States, you're going to see less patrol divisions and more units of this type pairing law enforcement with mental health professionals. And even the Department of Justice and Bureau of Justice Administration have both put a lens on this type of programming. I'm actually in North Carolina right now at the co-responder conference. I think actually some of Mike's folks are down here, I believe. And at this conference right now, about 3/4 of all attendees are law enforcement. And so there's a lot of eyes on this type of programming. So I think it's only going to expand. Yeah,
definitely. How do you anticipate that programming expanding more into specifically youth and children's programs? I mean, do you see it potentially becoming, we have officers in schools. Could you see it potentially becoming where there's a connection there or in other directions?
Yeah. Currently we have school resource officers. It's actually not uncommon for our co-responders to work with the school resource officers. There's not really like boundaries as to who they can work with. Ideally, school counselors and schools have their own supports within their system, where I think the law enforcement liaisons, the co-responders, we call them law enforcement liaisons, can be particularly effective as outside of the school system. So they're available at non-traditional hours. We get calls to our law enforcement for kids that refuse to go to school. And so that's a perfect use of a co-responder rather than having a police officer show up at the house and engage in those instances. So I think there is a lot of creativity going into these programs and how they can be used. And that includes cross-training between law enforcement and co-responders, involvement with the CIT training, and even, we're doing some unique training in how to approach an individual who might have autism spectrum disorder and how the co-responder can help with that. So there's just a lot of creative uses between law enforcement and co-response programs and how they can engage youth and families in the community, in schools, in residential settings, rather than just having maybe a traditional police officer show up or no response at all.
Yeah, I think the struggle we've been asking police officers in this country to do too much for my entire career. That's 30 years. And it's longer than that, quite frankly. But I think the struggle is in rural communities, especially in Iowa, and finding the resources. I think that we're unique in Marshalltown. Our population is 28,000 people. I think there's not many police agencies or communities our size in this country that are exploring services like this. And it's not because they don't want to. I think everybody recognizes the need for it. It's finding the resources necessary to make it work. So we see programs like this in metro areas frequently. And I think we need to find a way to make sure that our rural communities are receiving these types of resources as well, because we have the same need as Cedar Rapids or Des Moines has.
Yeah, definitely. So how have you seen, being one of the first few rural areas to really focus in on this, how have you seen that how do you think that it affects rural areas? Is it different than urban areas, or is it really just the same problems that are happening everywhere?
It's the same problems, the same challenges. I think where we're unique is it's harder for us to find mental health resources when we need them. And the reason we started this program, quite honestly, is we had access to crisis services, and we still use crisis services or mobile crisis. But the problem is, especially during COVID, they weren't responding. They were doing everything by tablet or over the phone. And what we find is that if we can get somebody in the field with us, we have better results, and people actually follow through with the recommendations that are given, and we can help them do that. I think the biggest value that we've had from our program is the case management aspect of it, because YSS of Marshall County, they can't provide all of the resources that somebody might need, but they're a bridge to other community resources and other help that is available. And they manage those cases to make sure that people follow through with phone calls, follow through with getting medication, follow through with setting up appointments. I don't think that many rural communities have that opportunity because the resources just don't exist.
Yeah, definitely.
I'll add, just throw in a few other things with some of our rural co-responders, Benton County and Delaware County being two examples of those where we have them embedded with sheriff's departments. Especially right now is a really glaring example of some of the gaps we face. I'm just going to throw out gas prices, for instance. The folks we work with in rural counties, they can't afford the gas to drive to Cedar Rapids or drive to Iowa City to get the mental health services they need once a week, let alone 3 times a week. And so in Iowa, we've done things to support families and individuals, such as the telehealth parity law, but we still have some major barriers in rural communities. Like Mike said, some other examples would be maybe you have one therapist in the whole town, and maybe that therapist isn't right for you. Maybe you are a Black or brown person and you want a Black or brown therapist. Maybe you're a man and you want a male therapist. Maybe you need a psychiatrist that specializes in youth. Those are not available in the vast majority of rural communities in Iowa. And there are a lot of barriers to driving to urban areas to access those services. And so these co-responder models are, again, a piece of that puzzle, whether it's doing case management or whether it's doing the just the crisis de-escalation on site with law enforcement.
Yeah. So what's the solution for, I guess there's probably not any clear solution, but what comes to mind as far as things that could help to improve that system for rural communities? Is it just increased funding, or is there anything else that can be done to increase the opportunities?
Well, I think funding is a big part of it. And we've been talking to state and federal elected representatives about the need for funding. But I think I think we've been blessed here in Marshalltown as the police department has partnerships and collaborations with a lot of different organizations in our community. And we've spent a lot of time over the last many years building those relationships. And I think where rural communities might be able to move down a positive path with these programs is just being intentional in building relationships with local mental health advocates or victim service advocates, crisis services, and looking for ways that they can collaborate. There may be things that you can do that don't cost a lot of money that might help you get some level of a program off the ground. Money's a challenge everywhere, but there are things that we can all do. It's just going to take a willingness to partner. And sometimes law enforcement has been guilty of operating in a silo for many years, okay, during my career. And we all have to recognize that if we want to address complex problems in our community, it's going to take a multidisciplinary approach. And we have to be willing to break down some of those silos and start working together.
Yeah.
I think we need probably better care coordination between various service providers. That's a struggle you hear about everywhere. Probably stronger partnerships between law enforcement, community mental health providers and hospitals, as well as schools. Again, there's a lot of barriers to care coordination when you're working with a youth or a family who's in crisis or in crisis on a regular basis. I do feel hopeful about things like the co-responder programs. These are communities figuring it out and doing what they can with the resources that they have. This is a good piece of that puzzle, but we have a lot of things that we need to fill in. And I'll go back to, we still don't have a lot of good diversionary options for youth and families, even in our urban areas, whereas we have maybe more stuff built out for adults. If you are a parent that has a youth who is struggling with their mental health or behavioral health, you really only have two options: figure it out at home or go to the hospital. There is nothing in between in most communities, and that's a huge problem. And so some of the ideas that I know are being looked at across Iowa are youth mental health access centers. We have some adult mental health access centers, but as far as I know, we don't have any specific to youth right now, although some communities are looking at those. So that's an example of a diversionary option. There are discussions around youth crisis stabilization beds. So we have those available for adults right now. That's a place a youth could go for a couple of days when in crisis and be provided support by mental health professionals and crisis staff. So there are creative options out there that folks are talking about, and that's very exciting, but we still have a little ways to go.
Yeah, definitely. That makes sense. So as far as, Mike, you mentioned with how a lot of rural communities just aren't able to afford to create some of these connections. And obviously, working with groups that already exist and establishing those connections is one way to kind of reach that, and also looking for other opportunities. But for the areas that don't have someone close by, mental health professionals that they can connect with, or aren't able to afford that kind of a system, do you guys see, are there ways to train law enforcement officers to be better prepared for these situations themselves, even if they're not able to have someone on staff who can help with mental health cases?
Well, we provide law enforcement in the state with a lot of mental health training, a mental health response training, believe it or not. And that's been ongoing for, the last 15 plus years in the state. I think the Law Enforcement Academy has been very deliberate, and I know many law enforcement agencies have been very intentional about providing mental health training for law enforcement staff. But it's impossible to train our police officers to the level of a mental health professional, number one. And I think where rural law enforcement agencies have a big challenge is because I used to be a police chief in a small community, the city of Nevada, 7,000 people. We had 10 police officers. Those agencies tend to be training grounds. So you hire young police officers, you train them up, and then they go work for a big police department somewhere. So you're constantly seeing a turnover battle in some of these smaller agencies. And I think that becomes a big challenge for police chiefs and sheriffs in keeping their staff trained.
Yeah, that makes sense. Gotcha. So what other, changes and challenges are you seeing to being able to move forward with your current program and just being able to improve upon what you've done so far?
Well, one challenge we're facing right now is one of our crisis advocates is leaving us, and her husband has taken a job out of state, and so she's leaving the program, and we're struggling to find people that want to work these jobs, because this is we have a social worker in our building 7 days a week, 10 hours a day, and so and they're working 2 p.m. to midnight every day, and finding people that want to work those hours and work nights and weekends has been a challenge. And then just convincing people, we have a program that's working. And we've seen some positive things come out of this program. But every budget, every city and every county in the state of Iowa is dealing with budget issues. And so just trying to convince people that programs like this are a worthwhile investment and we have to keep going. That's my biggest fear, is just losing what we've started here because of budget impacts.
Yeah, you mentioned that it was originally going to be a 12-month kind of test run. Is that finished yet, or are you going to have to figure out more funding after those 12 months end?
Yeah, it was a 12-month pilot project that ended December 31st of 2021. And when the city council gave us $150,000, they told us don't come back because we don't have any more money. We went back and they gave us some more money. And we were able to write a federal grant too that has helped out a lot. So right now we have funding to maintain the program that we have through at least 2025. But we would like to expand the program because, as I mentioned earlier, the only complaint we receive from the police officers is hey, where were they at 2 o'clock in the morning because I needed somebody. So we would like to expand the program, and we probably will never be 24/7, but we would like to cover more of our peak hours than we are now.
Yeah, for sure. Drew, are there any things that you can think of that really are just roadblocks or challenges that kind of stand in the way of expanding programs like these to be able to fill some of the gaps that currently exist? I know Mike mentioned some staffing and funding problems, but is there anything else, or you can comment on that further?
Yeah, and I just wanted to circle back earlier. There are many barriers to finding supports in rural communities, but we cannot go down the path of relying further on law enforcement to solve this problem. That has not worked for the last 3 decades, 4 decades, 5 decades. There has got to be another path forward. And I think that's the realization we're starting to see. Law enforcement cannot solve this problem. CIT training is a wonderful resource. It is nowhere near enough to prepare an officer to work with a lot of the situations in which they're engaged, especially on long term. And so a lot of the high utilizers of law enforcement, they need really significant mental health care. And CIT is not intended for that type of interaction. And the other thing I would say is we are paying for this, regardless if we pay for it through mental health professionals or we have law enforcement do it. I will guarantee you the cheapest mobile response team, maybe the most expensive mobile response team or the most expensive co-responder is a lot cheaper than sending someone through the criminal justice system. And so one of the pieces of that is we have to acknowledge that we're already paying these costs. We're just paying a lot more for them. Rather than getting early intervention on scene and early prevention on scene, which is really significant here. And that's really what we're trying to get at. Some of the barriers we've noticed, at least on our end, some departments are skeptical of this type of programming. It can be difficult to get law enforcement buy-in in certain areas. It can be difficult to get boards of supervisors to buy into this type of programming. And so there's still a lot of work to be done there. Law enforcement understandably can be skeptical of mental health. If you talk to law enforcement officers, they'll say, look, over the years, there's been all sorts of services promised to us as being effective, and they last 6 months or 12 months, or they don't work as advertised. Is this just another one of those? And so those are some of the barriers that we face. Of course, funding is always an issue, but I'll go back to we are paying these costs whether we want to or not, and we're paying them in a far less effective manner already. That messaging is really important. And I think as the international co-response conference that we're at here, as these types of organizations start to grow and their messaging picks up, I'm hopeful that some of those barriers will start to come down and we'll see more adoption across the state of Iowa, but also nationally into partnerships between law enforcement and mental health that are similar to the co-response type models.
Yeah, definitely.
I agree with everything that Drew just said. The problem is he's right. We're already paying for these services, and it's much more expensive to put people in the criminal justice system. I think it's hard to convince people of that at times, though. And I've been asked, well, does this mean we need less police officers? No, that's not what it means. And so while I'm already paying for police department and for the jail, why do I have to pay for another resource? And I think we still have a long ways to go in educating the public about the significance of these problems and how complex the problems are that our mental health professionals and our law enforcement officers are facing every day. And I think a lot of people, it doesn't affect them or impact them. So they just struggle to understand why we need these services.
And Emily, if I could throw one other thing in there, the thing I would say is we have to hold our policymakers accountable. And I'm going to speak a minute about the absolute tragedy in Texas, the catastrophe in Texas. And so being in crisis services for a decade now, every time something like this happens, I get calls from individuals, or at Foundation 2, we get calls from the media talking about mental health. And mental health is not the only solution to this, but it is an important component of it. And every time one of these happens, I hear our policymakers talk about funding mental health, funding mental health, funding mental health, and it never, ever, ever happens. And what happens is actually the opposite. We continue to see money moved out of mental health funding in creative ways. And so one of the things that we need to do, and I would beg people to do, is if a policymaker says, well, we can fix this with mental health, is to push them on the specifics of that. What do you mean fix this with mental health? How are you going to do that? What are you putting on the table to do that? And, I'm sure many of us are sick of seeing these types of events happen. And again, mental health is not the only component of this, but it's an important component. And we need to hold our policymakers accountable. They need to appropriately fund mental health care in Iowa. They need to appropriately fund it nationally. And they are the only way that we can access those types of services and build them out.
Yeah, definitely. So are there any systems in place or programs that you guys have that you're working with to be able to spread that information? You talked about kind of education and getting that messaging out there that this is a solution, and as far as also holding people accountable. I mean, does the public know that this is something that they need to be thinking about?
Go ahead, Drew.
Well, I'm the public, and I know. I would say that, and I'm guessing it's the same in Marshalltown. We are working with the mental health regions, and they certainly are interested in this type of programming. There is some state level advocacy happening in Iowa. NAMI has been involved in those discussions as well. And so on the advocacy side, there is no shortage of advocacy. It is, again, I think that after these terrible events happen, it seems like sometimes the mental health funding piece is used maybe as a kind of a quick talking component, but it's never backfilled on the other end. There's never actually policy put in place. And so, again, we'll continue to do our work for advocacy. I'm guessing the majority of the public aren't aware of that because we all have lives and we're busy, but there are a lot of lobbying groups and advocacy groups that are trying to get the appropriate funding in place to support these types of services, both within Iowa and nationally.
Mm-hmm.
Our program here in Marshalltown has received a lot of attention statewide, actually, and a little bit of national attention. And so I'm at the end of my career, and I'm dedicated to spending the last couple of years I have in this career shouting about this issue from the rooftops and talking about our program. I think people are starting to pay attention. I think because of some of the tragic events that happened in 2020 involving law enforcement has brought a lot of positive discussion to these issues. And I know that my peers across the state, other police chiefs, they're listening and they're looking for opportunities to get involved or build their own programs, because they understand that it's important and these are necessary things that we need to have in our community.
Yeah, absolutely. Okay. I just want to throw out another reminder for our audience. You're welcome to throw in any questions that you have, or thoughts or comments, or as well things you'd like to add to the discussion or you'd like to hear more about. We definitely want to be able to answer anything that anyone out there is wondering about this topic. Jumping back a little bit, something that both of you mentioned a little bit when we were talking about the difference between training police officers and having actual mental health professionals on staff, as you talked about CIT training. And I know that's a term I've heard a few times, but just to be clear on what that is, can you kind of tell us what that training is and kind of where it falls short as far as what officers are able to do compared to actual mental health professionals?
Sure. So CIT training is traditionally a 1-week training, crisis intervention training that law enforcement goes through. It is a great program. It is what law enforcement needs, but it is 1 week, and 1 week of mental health training is certainly not enough to deal with complex mental health needs. Mental health professionals range from master's degrees to doctoral degrees and years of training, and so it is a good step. But again, I will go back to the long-term goal should not be how do we get law enforcement to solve this issue. It should be how do we take law enforcement out of the picture as much as possible, so that they don't have to do this and they can do the other aspects of their job. And so I wouldn't say CIT falls short. I would just say that it is not intended to be the fix for these types of situations. It is a support to law enforcement. It is to help them maybe better conceptualize what they're working with when they go out on a call involving someone in crisis. But it is certainly not, again, a piece of the puzzle, just like the co-response unit, but it is certainly not the long-term fix for the systems we have built, where we are basically funneling people with severe mental health issues to law enforcement.
Yeah, definitely.
Yeah, I agree with what Drew just said. So when I first started in this career, we didn't receive any mental health training. And so we've come a long ways, but it's impossible to train our police officers to the level that is necessary to deal with many of the complex problems we're seeing in our communities. And I think Drew mentioned earlier, but the people that call us over and over and over again are the people that really need significant help. And our law enforcement officers just aren't equipped to do that. And oh, by the way, they don't always have the time that's necessary to spend to help people when they're dealing with those types of challenges. So most police agencies in the state are very busy, and our officers have a lot of calls that they have to get to. So they look to handle things as quickly as possible. And when we're talking about a complex mental health issue, you need to invest a lot of time and resources into those problems so that you can truly help people.
Yeah, definitely. I know nationally they're working on, I think someone mentioned this earlier, the 988, which would be similar to 911, a 3-digit number you can call for mental health services. How is that going to play into the services or the programs that you guys are already working with to get people connected to mental health services?
Yeah, so 988 is a rebranding of the National Suicide Prevention Lifeline, which has been around for decades. Foundation 2 Crisis Center answers the National Suicide Prevention Lifeline and will answer 988. It's a good step in the right direction. So this was a federal legislation to transition it to a 3-digit number. And that's going to improve some technology upgrades. And so 988 is overseen by SAMHSA. And so there will be some significant public awareness campaigns, or at least that's what we're told by the federal government, and improvements in how people are routed to local crisis centers, as well as the types of support they can receive. It's going to take time. That goes live in July of this year, although you can already call the National Suicide Prevention Lifeline. It's just a longer number. However, on many cell phones, it's already transitioned to the 3 digits. But we should start seeing advertisements at the state level and public awareness campaigns in July for 988. Again, it's the NSPL, the National Suicide Prevention Lifeline, is a great resource. There needs to be more public awareness around it. It's a great place to start. And so ideally that will, for many people, I think that, SAMHSA's vision of that is that would be the first place they would call when in crisis, rather than dialing 911, and that the counselor on the phone would be able to connect them with supports necessary to them. Then if that wasn't enough and it escalated to 911, then you have the co-response team coming out. And so the idea with 988 is the least intrusive intervention, because the least intrusive intervention for a youth or a family is the cheapest intervention. It's also often the most effective intervention. And so we have to keep moving towards that kind of area, this less intrusive early prevention. Early prevention is super important with mental health. So we're talking about youth today. And so we know, just like with physical medical disorders, just like cancer, early intervention is absolutely critical when it comes to mental health. There's absolutely no difference. And so these types of programs hopefully will, at some point in time, all flow together. 988, co-responder programs, mobile crisis teams, crisis stabilization units. That's my hope, and I think that's the vision of SAMHSA and the federal government. But there's work to do around that.
Yeah, for sure.
I think it's going to be a great resource. I think we need to guard against, well, we don't need our co-responder program now because we have 988. And that's the only thing that I'm concerned about, is that people are going to try to make that argument. And there's still going to be times that we need to be able to deploy co-response programs into the field to help people real time.
Yeah, definitely. Do you anticipate that will decrease the amount, I mean, I guess filter out some of the calls that would be coming to law enforcement that aren't necessarily law enforcement related calls?
SAMHSA does. They've released projections. They do. Mike is absolutely right. It is not going to supplant co-responder programs. And I'll go back to what I said earlier. My opinion is that co-responder programs, the need for them will continue to grow. And over the next decade or two, you will see most major law enforcement departments in the United States will adopt some type of co-response program. There will always be a need for that. And there will always be a component of mental health care interacting with law enforcement. But SAMHSA, in their projections that they've released to crisis centers, does believe that it will take some of the unnecessary or maybe ineffective law enforcement calls away, but there is absolutely no shortage of them. And so, that is another piece. I'm using this puzzle metaphor all day, but that is just another piece of the puzzle to put into place.
Yeah, definitely. So as far as things that civilians, regular community members can do, I mean, we talked about kind of pushing for funding and those kinds of things. How, I guess, are there any other ways that community members can be actively helping to prevent mental health crises, or to kind of help law enforcement in this journey of making those connections and working through this to come out better on the other side?
Well, I would encourage people just to be engaged with their local government and with their local police departments, and look for opportunities to learn more about some of the challenges and problems that your local police department or sheriff's office are facing. We have a Citizens Academy program here in Marshalltown, and we hold that once a year, and it's a great opportunity for people to come in and learn more about the police department and some of the challenges that we're facing. And I think people walk away from that with a clearer picture of what's going on in our community and how they might be able to help the community. I would love to see more people come into our city council meetings. Our city council might disagree sometimes, but it's usually an empty room, or it's the same folks coming every week. So I think you need to be more engaged in the community and start paying attention to these issues. Mental health, I think, impacts more people than many people understand or believe. And I think our community, because of this program and because we've been talking so much about the Marshalltown Police and Community Team that we started here, they're getting a clearer picture of some of the mental health challenges that we're facing in the community, and they're starting to ask questions about how they can help.
That's awesome.
Yes, I second everything Mike said. I would say that every human alive has been somebody in their life who struggles with mental health, and most of us somebody who severely struggles with mental health, and most of us know someone who has died by suicide. And so, if it's something that you feel passionate about, I thought I was on mute for a second. And I realized, no, I'm not on mute. If that's something you feel passionate about, there are advocacy groups across Iowa that you can get engaged with. You can attend your regional governance meetings. You can sit in the audience and listen to those and see where mental health priorities are going. And then awareness is huge. And so we still struggle with awareness. And so if you know someone in your life who is struggling with their mental health, help them connect with a resource out there, help them reach get to that early intervention piece, and get the resources that they need. So those would be my recommendations. Yeah,
definitely. Do you think, as far as mental health and law enforcement as a team, how do you think that plays into the discussions Mike, you mentioned that, this came up a lot in 2020 discussions about police reform and stuff. And how do you think that adding mental health liaisons, those connections to the police department, plays into the various theories that people have about police reform and how police officers function in society?
I don't know how to answer that question. What I'll say is, I think 2020 allowed us to have some discussions that we've needed to have for a long time. These aren't really new issues or new problems, or quite frankly, I've been a police chief for 18 years, and my peers have been talking about these issues for 18 years and looking for solutions. I think what 2020 allowed us to do is more people were willing to have the conversation, and maybe more importantly, policymakers and elected officials were willing to throw some money at the issues where they hadn't been willing to do that before. So we have we have good law enforcement in the state of Iowa. We have great cops in the state of Iowa, great deputies in the state of Iowa. Police agencies doing the right things for the right reasons and working very hard to serve their community. But as I mentioned earlier, we're asking police officers to do too much, and we need to find ways to give our local law enforcement agencies the resources that they need to keep people out of the criminal justice system. And that seems kind of weird. I go talk to people about that, and I show up and I'm wearing this big utility belt and I have 2 pairs of handcuffs, and they think it's my job to arrest people, but it's really my job to prevent crime and to try to keep people from getting arrested. And I think most law enforcement agencies in the state understand that, and they believe in that. They just don't always have the tools and resources that they need to make that work. And so programs like this, I agree with Drew, they're going to grow. And we just need to find a way to help our local law enforcement agencies find the program that works for their community, and then put as much support behind that as we can.
Yeah, definitely. Did you have any thoughts, Drew?
Not many. I would say that I think most advocacy groups seem to be in support of this type of programming. Again, not affixed to problems of equity within our criminal justice system. That this is not affixed to that, but it is it is a piece of the puzzle, and so it does. In some communities, depending on the goals of the co-response program, it can be a part of equity within a criminal justice system. It depends how you build it out. And that's the other cool thing about co-response programs. They're very tailorable to the communities they serve. The programs in Marshalltown don't look like the programs in Cedar Rapids, and the program in Cedar Rapids doesn't look like the program in Benton County. There is a local flavor to it, and that's what's really, because communities are different and they're unique in their needs. And so that's why this type of programming is really cool.
Yeah, definitely. All right, well, it looks like we've got about 15 minutes left, I think. So I'll just throw out one more reminder. If anyone has any questions or anything they'd like to hear addressed, now is the time to send us that. But is there anything, I guess, that either of you two think that we've missed in this discussion today, or anything else that comes to mind that you would have liked to talk about with the topic of children's mental health in law enforcement and mental health in law enforcement in general, or anything? I guess, what do you want our audience today to walk away with that they can do, or that they can lean on for future discussions in this category, in this topic?
Hold your policymakers accountable. We've had our state senators directly reference mental health in the follow-up to this terrible events in Texas. And so what are they going to do about it as policymakers? That's part of their job. And so they need to follow through. That's the only way we can access the funds to do this type of work.
Yeah, I agree. I think sometimes our policymakers, they say the right things, but their action isn't always in keeping with or in tune with what they're saying, or they do just a little bit. And we need to go the extra mile to make sure that we're providing the services that are necessary in our state. I think we do an awful job of providing mental health resources in general in the state. I think things have gotten better over the last 5 or 6 years, but there's a lot of work to do. And I think when it comes to children, especially, we need to do more. And we're not even close to hitting the mark. So I agree. We need to keep our policy makers informed and hold them accountable to what they're saying.
Yeah, definitely. All right. Well, we're a little bit short on the hour, but I think we've had a great discussion. I think this has been a good amount of time, and what we've talked about has been really helpful. So I'm gonna just, I think, wrap up unless either of you has anything else you'd like to throw in, or if we get a last minute question. But thank you everyone for coming. Thanks to Mike and Drew for this discussion. I think it's been really good. And just want to throw out for tomorrow, we still have one more session for the in-depth week. Tomorrow at noon also is mental health resources in schools. That'll be led by Zach Chukarski, and there's going to have a couple really good panelists to talk about that and how we're helping children in schools with their mental health. So be sure to tune into that session tomorrow. And yeah, thanks everyone for coming out. Appreciate it.
Thanks, Emily.
Thank you.
Thank you.
Thank you.